Hello, my name is Angga with lesson number 194. Our reason to choose this topic is because cancer has high mortality rate and predicted will reach 16.4 million deaths in 2040. To fix this, we can do screening and early treatment to detect, improve our patient prognosis, and reduce our medication costs. Next slide. These are our main problems that will be interesting to discuss in our student project. Next slide. These are our main goals that we want to achieve. Next slide. From the student project, we will know better about cancer epidemiology, improve our awareness, and detect cancer as early as possible.
Cancer is a large group of diseases when abnormal cells grow uncontrolled that can start in almost any organ or tissue of the body. These abnormal cells are malignant tumor. There are some difference between benign and malignant tumor or cancer. Like generally, benign tumor grow more slowly than malignant tumor. Benign tumor have clear boundaries so they can be removed completely by surgery, and the result is they are less likely to recur. If recur again, is only the original site. The cancer cell can break away from this original mass of cell, then travel through the blood and lymph system and stay in other organ where they can again repeat the uncontrolled growth cycle. This process called metastasis. There are some different types of cancer like sarcoma, carcinoma, leukemia, central nervous system cancer, and multiple myeloma and lymphoma. Sarcoma is cancer that begins in bone, cartilage, muscle, blood vessel, fat, and other connective or supportive tissue. Carcinoma is cancer that begins in tissue or the skin that line or cover internal organ. Leukemia is cancer that causes large number of abnormal blood cells. And central nervous system cancer is cancer that starts in tissue of the brain and spinal cord. And multiple myeloma and lymphoma that cancer start in cell of the immune system. Next.
In the year 2015, cancer becomes the leading cause of death and the cause of decreased life expectancy worldwide. As for 91 out of 172 countries, cancer becomes the first or second cause of death in people under 70 years old. In 22 other countries, cancer becomes the third or fourth cause of death.
Cancer is the leading cause of death above stroke and coronary heart disease due to the increase of the risk factors including population growth and aging and socioeconomic development. So that in 2018, there were 18.1 million cases and 9.6 million deaths due to cancer in the world. Nearly half of the case and more than half of the world's cancer deaths occur in Asia because Asia has nearly 60% of the global population. Meanwhile, in Europe, accounted for 23.4% of total cases and 20.3% of cancer deaths, followed by America, which accounted for 21% of incidents and 14.4% of deaths.
As a cancer surveillance is for planning and monitoring effort in prevention of the disease. Currently, prevalence of cancer in 2017 ranged from 0.4% to 5.5% worldwide. The incidence from 2013 to 2017 is 442.4 in both sexes. Cancer mortality in men is 189.5 and 135.7 in women. The survival rate of cancer is increased from 50.3% to 67% in 2007 to 2013. In Indonesia alone, from 2013 to 2018, cancer prevalence is around 775,000 cases. The incidence rate is 136.2 and mortality rate is 84.1.
Then there are years life loss or YLL, years life with disability or YLD, and disability adjusted life years or daily in measurement aspect. The relation between YLL, YLD, and daily can be seen from its addition formula between YLL and YLD that become the basis formation of daily. The cancer disease still have the same trend or pattern based on the latest research, although there are no exact number which can show the YLL, YLD, and daily number that are similar to one and another either on developed or developing countries. The number of daily cancer is still in the highest level due to a fact that YLL and YLD value still tend to be high despite being followed by various.
Lifestyle can also increase a person's risk factor for cancer. So now I want to tell you lifestyle that related to cancer risk factor. The first one is tobacco. The carcinogenic chemicals in tobacco smoke can trigger an increase in cancer development. The next one is alcohol. Most of the risk association between alcohol consumption and the development of cancer caused by ethanol. Obesity. Obesity or overweight is associated with an increased risk cancer, including endometrial, esophageal, hepatocellular, carcinoma, etc. There are at least 7 viruses that are associated with cancer risk, including Epstein-Barr virus, HPV, human T-cell lymphotropics virus, HCV, Kaposi herpesarcoma virus, and Merkel cells polyoma virus. And the last one is ionizing and non-ionizing radiation can also cause cancer.
We face challenges in fighting cancer. The incidence of cancer in 2018 is 18 million cases with 9.5 million deaths. In 2040, it is predicted that the incidence will increase by 11.5 million cases and the death will increase by 6.8 million. The challenge that we face is we need to reduce both the incidence and mortality of cancer. To minimize the incidence and mortality, we need more screening, early detection, and understand of risk and protective factor of cancer, which will reduce the incidence by 30 to 50%. We also need to improve the society's awareness to prevent cancer.
Okay, I will tell you about principle of cancer screening. Principle of cancer screening are based on the following. First, knowledge of the disease. The condition screened should be an important public health issue. Second, knowledge of the test. Test should be simple, safe, precise, and validated. Third, intervention. There should be an effective intervention for the disease. And the last, screening program. The benefit gained from the screening program should be outweigh any harm.
Application of cancer screening principle. Screening for cancer started in middle 20th century, and the first one is cervical cancer. In US, screening program has decreased overall cancer mortality by 25% from 1990 to 2050. Both cervical cancer and colon cancer screening is a direct method of screen cancer. And the difference with cervical and colon cancer, some other cancer rely on indirect methods to screen for cancer, such as radiographic imaging or measuring a biomarker. One of the examples is ovarian cancer. Although screening for cancer gives some benefit, there is also potential harm. People with false positive result may undergo follow-up testing that could be uncomfortable, expensive, and potentially harmful. And there's also physiological consequences. People with false negative result may experience delays in diagnosis and treatment of his or her disease.
The World Cancer Research Fund has recently estimated that over 32% of cancer death can be avoided by ceasing cigarette smoke, whereas approximately 20% of all cancers may be prevented by reducing overweight, enhancing physical activity, limiting alcohol consumption, improving the nutritional status, but also reducing environmental or occupation exposure to carcinogenic substance. Despite many efforts have been made in the past decades, the armamentarium of in vitro diagnostic has remained considerably narrow in cancer and mostly limited to the early diagnostic of specific malignancies.
Cancer laboratory diagnostic has been researched for a long period of time, yet has remained narrow and limited. So many literature has changed the perspective of cancer diagnostic, and some through epidemiological study. One example of literature said that anisitosis should now be considered as a clinical efficient marker of disease severity of liver cirrhosis to become hepatocellular carcinoma. Another said that PKC epsilon is significantly overexpressed in myelofibrosis patients. A literature said serum biomarkers such as CA125 and human epidermis protein 4 are not enough sensitive or specific for early diagnostic of ovarian cancer anymore.
The summary of our student project are: cancer begins when abnormal cells grow uncontrollably that can start in almost any organ or tissue of the body, and cancer is the first or second cause of death in 91 of 172 countries. So, to estimate the prevalence and mortality, we need measurements such as years life loss, years life with disability, and disability is just life years. The incidence and death of cancer can be caused by external factors like tobacco, alcohol, obesity, infectious agents, and radiation. Because of the malignancy and epidemiology of cancer, this becomes a challenge for us. As the solution, we can reduce mortality with screening, early detection, and potentially medical treatment. The principles of cancer screening are knowing about the disease and test, the intervention, and the screening program. Last, in the past decades, how to diagnose cancer are using in vitro diagnostic, traditional biomarker alone, and their integration within cancer detection model by means of machine learning. But these methods are not still good enough for diagnosing cancer. Because of this problem, some research have found that the red blood cell distribution width can be considered as a marker of disease severity. Thank you.